This is Paul Barr, Senior Writer for Hospitals and Health Networks magazine. I'm here with Jim Hinton, who is President and CEO of Presbyterian Healthcare Services and the new Chairman of the American Hospital Association. Jim's more than 30 years at Albuquerque-based Presbyterian includes a heavy dose of work with physician practices while in an integrated care environment. His experience should prove useful as he guides the AHA in 2014 through the industry's movement toward using more risk-based models of care. Thanks for being with us today, Jim.
Thank you.
What are some of your goals for the coming year as chairman of the AHA?
The AHA as an organization is very, very strong, and I think is at the right place at the right time in this new healthcare world that we have entered. Most of our members in the AHA are really struggling being caught between these two worlds. One world is fee-for-service, and one world is value-based care or some forms of risk.
As hospitals are asked to take on more health risk, what can be done, what can they do, and what can the AHA do to ease that process?
Well, I think most hospitals in this country are working on the individual costs of care, the unit costs in their system. So they're doing a great job of focusing on quality improvements that reduce cost, reduce length of stay, supplies, staffing, those types of issues. The next frontier is going to be on working on more of a population view, the total cost of care, and making sure that as the total cost is reduced through different types of utilization, that hospitals can continue to pursue their missions.
Presbyterian owns its own health plan. How will that experience affect your efforts to help hospitals with risk-based care?
Well, we've owned a health plan for almost 30 years now, and during that time, we have learned a great deal about the role that a health plan can play in an integrated delivery system. And I would hope that I could bring some of those experiences to bear on the transition that this field is going through. And, just owning a health plan is not enough. It's how you integrate that health plan with the delivery system to create new incentives and to really give rise to new forms of innovation that are not as based upon the old payment systems, but can actually be enhanced by a friendly or collaborative health plan.
Is there anything special that you would need to do for hospitals that are maybe lagging behind other hospitals in terms of adopting new models of care?
Through the Committee on Research, which I have just recently chaired, what we know is that hospitals are at a lot of different places in this country. They start from different core competencies, different types of hospitals, different demographics, urban, rural, specialty hospitals, et cetera. So I don't know that it's fair to say that hospitals are further behind. They're just starting at different places. The Committee on Research has been focused on how we can create pathways forward for all of the field, regardless of where they start. But there are some, fundamental or core issues that we have to help all hospitals with. Focusing on quality of care, reducing unnecessary utilization, engaging the workforce in quality improvement, and then partnering as we can with payers to help promote that type of a transformation.
Speaking of the Committee on Research, the committee recently produced a report on integration and transformation.
The report is very clear that it's at a point in time that we're trying to help create some roadmaps or pathways for all members of the hospital field. And so it won't answer everyone's question, but I think it can serve as a good guide. It has some very specific questions that we would suggest that all members of the hospital field ask themselves as we're all preparing for this new world of focus on value versus on volume.
And also your experience, I believe, has been working with physician practices in a hospital environment. Is that something that you'll feel will be important experience?
At their core, hospitals are clinical enterprises, and having aligned, engaged physicians, whether they be independent or affiliated in other ways with the hospital or directly employed, is obviously going to be an important part of this journey. I'm actually the most optimistic about where physicians are in this country of almost any other segment of our business. I think physicians are driven by data. They want to do the right things for their patients. And I think they're seeing that some of these new care models really can serve patients in some very new and creative ways that will improve their health.
Is there anything going on in New Mexico regionally that you feel could be applied to the national stage?
There is. In the state of New Mexico, our state has accepted expansion of Medicaid, and there's a new program to reorganize how services are provided for Medicaid beneficiaries. Core to that program is a focus on care coordination. A lot of the problems in quality and in cost are a result of handoffs between different parts of the healthcare system. And so while this new program will start in 2014, I'm very excited about its potential for the overall field.
Well, thank you for being with us here today.
Thank you.
This is Paul Barr of Hospitals and Health Networks magazine. Thank you for watching.